All across America and around the world, this is Veterans Radio. This is Veterans Radio.
Good day. I'm Jim Fausone. I'm the officer of the deck today here on Veterans Radio, and thanks for joining us. We've got some interesting stories for you. We always want to remind you you can find more about Veterans Radio at its Facebook site or at the web, veteransradio.org, where we're on the web 24/7. You can find a lot of our podcasts there as well. We post new ones every Tuesday, so you can get a new story, a new interview, something you didn't know before by going to veteransradio.org. And before we get started, we want to thank our sponsors. First up, we want to thank Legal Help for Veterans. Legal Help for Veterans fights for veterans' disability rights all across the nation. You can reach them at 800-693-4800 or on the web at legalhelpforveterans.com. We just want to remind you that Veterans Radio podcasts are available on all your favorite streaming platforms, including RSS.com, Apple Podcasts, Spotify, YouTube Podcasts, iHeartRadio, and Rees Across America Radio. So wherever you are, you can find us, whether it's on your mobile phone or your computer or your laptop, your tablet. But listen in to Veterans Radio Podcasts. We post something new every week, and you're going to find it informative. We want to welcome to Veterans Radio today Dr. Jim Lynch. He is one of the world's experts on something we're going to talk about, but to set this up so our Veteran Radio listeners know this guy knows what he's talking about, he went to West Point. He did 31 years in the Army, medicine primarily, colonel, was Army Special Ops medicine in particular. Dr. Lynch, welcome to Veterans Radio.
Great. Thanks for having me, Jim.
Well, give everybody a little bit of 31 years experience. That's not why we have you on. We have you on specifically to talk about Stellate Ganglion Block, which is a treatment for PTSD. But let's make sure people understand they know from where you come.
Fair enough. I think so. Being a veteran myself, I'm typically skeptical of things. Medical community in particular is probably fair to say. I don't mind saying that. I think it's helpful when people come from the same cloth, probably. So I did spend 31 years in the Army. My first 10 years, I was an Army officer, and then I decided I wanted to become a physician. So I went back to medical school, and the Army scholarship put me through school, and I came back on active duty and spent 21 years as a physician in Army Special Operations and had a great career. Got a chance to deploy to combat multiple times, both as a physician and before I was a physician, and retired out of active duty about 5 years ago and settled in Maryland, where I've dedicated all of my medical expertise to this one thing called Stellate Ganglion Block, which is not a treatment only for veterans, but that's where I began doing it, so it's kind of an obvious place to discuss it.
Yeah, and during your career, you glossed over it, but I won't, so that people, again, kind of know where you're coming from. You had deployments in Panama, the first Gulf War, in Iraq, Afghanistan, Syria, throughout Africa, a lot of this in support of special operations activities going on in those territories. So been there, done that is kind of your story.
That's correct, although I would hate to say it like that. And everybody has different experiences for sure. But I do think it's helpful if you run in the community with veterans of all different branches and different experiences and different combat deployments. It's helpful to have those experiences as a physician who's helping veterans who have struggles with mental anguish, whether it's PTSD or anxiety or other things. So I do think it's helpful to have similar backgrounds and done similar things and jumped out of similar airplanes and whatnot. So yeah, I do. I appreciate you mentioning that.
Well, and part of this is particularly in private practice medicine, they've not been exposed to what veterans do. They don't know maybe right questions to ask or how to interpret certain answers. And I'm not just talking about doctors, it's nurses, it's nurse practitioners. So few people have military medicine experience. And when you take a history from a patient, understanding their background is important, and maybe understanding their resistance to certain types of treatment or certain types of therapy or counseling. And again, we've talked to folks for 20 years on this on Veterans Radio, so we have a little sense of there is a gap between private practice medicine and those who have been in and understand military medicine.
Yeah, absolutely. I actually think it's a giant barrier to care. And I think, my hope is in being on this show today is that this may reach some people whose previous experiences with the medical community probably fall short. And you kind of equate it to, well, I'll ask for help and maybe somebody hands you a bag of pills, may not really understand what you're describing when you describe the things you've been through, which leads most veterans that I know to just, you don't even want to talk about it. You don't want to say it. You don't want to go through the problem of describing or the challenges of saying what you do. So you usually have a really short answer. And that's too bad because it interferes with the therapeutic relationship. If
we're really good at saying, I'm fine. We're really good at saying, everything's good, I'm fine. And that's not always the case.
Absolutely.
So this is a really interesting topic and not one that we've explored before, I don't think, on Veterans Radio, although it's a treatment technique that's been around for 100 years or something. So tell us what Stellate Ganglion Block, SGB for short, because that's a mouthful, Dr. Lynch is really about.
Yeah, stellate ganglion block. It is a mouthful. It's probably why there's a marketing problem. It's hard to say. Or SGB. It's a injection in the side of the neck using an anesthetic to numb a nerve. So it's essentially a nerve block, which turns a nerve off for a few hours, and then the nerve wakes right back up again. The procedure was used 100 years ago to treat pain, and it's actually still used today to treat pain. And it's not anything that I invented or anything like that. But about 15 years ago, while I was working at the Special Mission Unit at Fort Bragg, the challenge arose that there are people who are high-level operators, high-level elite people in different areas of work who are go, and unwilling to take a knee, unwilling to tap out or take a break. And with how busy things were, it kind of led to a few folks in the community looking for what other options existed. And a colleague of mine in the special operations community at that time had found that there was a doctor that had begun using this old procedure, meaning had been used for other reasons, pain primarily, had found out that it was helpful for PTSD symptoms. So we explored that. But what the procedure, and it turned out to be very helpful, like extremely helpful. So, but what it is just using anesthetic, like the same medicine the dentist uses to numb your tooth, using that same medicine along a nerve that runs in the side of your neck, which is called the cervical sympathetic trunk. And all this nerve does is it carries the signals from that have to do with the fight or flight system between the brain and the body. And they bounce back and forth, brain, body, and they are what allows you to stay alive and your body to respond to threats. It's actually a beautiful system, and it works great when it works great. But for some people, it ends up in a slightly elevated state, and it gets kind of stuck like that. And this happens. It happens to a lot of people. And it happens to a lot of people who are walking around who maybe no doctor has ever told them that before, but a lot of people sense it in themselves because they come and tell me that. They say, Doc, my fight or flight system feels like it's on all the time. I go 0 to 60 for the stupidest little thing, or my sleep is horrible, my concentration's bad. And what that sensation is the fight or flight system dialed up into a level that it's not supposed to be at. What the treatment does is the dumbest thing ever. It just puts the nerve to sleep. There's no fancy medicine or anything. It's just a straightforward nerve block. But the nerve that it happens to be putting to sleep is super important. And when that nerve goes to sleep for about 8 hours and then wakes back up again, that can have a significant effect to reset or reboot what essentially turns into a circuit where the fight or flight system is spinning at a level it should not be spinning at. So in the simplest terms, it's a lot like resetting your Wi-Fi router or pushing your finger on your computer and holding it down, resetting it, and letting it restart again.
So a lot of guys have been treated with a nerve block for a bad back, and so the analogy to a needle in your mouth to numb it before they do a procedure the dentist does also helps me visualize this. But is it that sort of same procedure that we think about when we have a bad back and we get a shot for, in that instance, it might be a steroid or something? Is it? It sounds scary when you say the whole name, but you've explained it in a way that sounds understandable, simple. Is it that simple?
Well, yes is the short answer. I think it sounds really scary. I think it's actually one of the barriers why people don't seek it out, because if somebody says, hey, I have this really useful tool, it will reduce your PTSD symptoms by 50%. I mean it's pretty, I'm not overselling it here. This is what's published in the literature. It's a very, very profound effect. And then you say, oh, by the way, it's a shot in the neck. Then people's eyebrows go up, right? Like that's not what you were expecting. And it sounds weird. It sounds scary for sure. Here's what most of my patients say. And it's an office-based procedure. So I'm not taking people to the operating room, although some other doctors do this and they make kind of a production of it. They charge people a lot of money for it. They do it under a fluoroscopy machine. But the procedure has been performed for 100 years without any fancy equipment. Nowadays, if you use ultrasound to steer and guide your needle, it's super, super safe, very precise. You can see everything in the anatomy, and you can steer a needle away from anything that hurts right to the target area and inject numbing medicine along the side of the neck. I use a dinky little needle that does not bleed. It's kind of like when you get your flu shot. They give you a Band-Aid, but half the time you didn't even bleed, and it feels like a pinprick. I can say that this feels like a pinprick, but without the burning part that you get with the flu shot. It's more a pinprick and a little bit of pressure. It's not that it doesn't hurt at all. Certainly there's a pinprick, but most people, when I'm done, they look over at me and they say, that's it? They're just shocked. They think it would be painful or uncomfortable. And it really takes me about 5 or 6 minutes, and I go very, very slow. I just take my time, and I'm kind of a slow person. I'm very paranoid. So I just walk my way through the procedure. But quite literally, in 5 or 6 minutes, we're done.
And it's guided by ultrasound. I mean, you're not, you're kind of watching when getting to it must be a specific nerve that you're trying to get to.
Yeah.
Is it?
Exactly.
How is the effect on this? I mean, is it something that, when you numb the mouth or you get the shot in the back, within a few minutes, you can begin to feel a change in your anatomy, if you will. So how does the patient react to this procedure?
Yeah, so it's so quickly is the short answer. What's important to note is when you use an anesthetic along a nerve, it just turns the nerve off. So it's like stops the electricity or the signals from traveling through it. The nerve that we numb when we do this procedure called SGB, the nerve doesn't carry pain or heat or vibration. What it carries are fight and flight signals. And the fight or flight signals from the entire body communicate to the brain, and all the signals in the brain communicate to the body. And where they connect is in the neck in this nerve called the cervical sympathetic trunk. And I'm pointing that out because it's essentially like this beautiful anatomic funnel where all these very important signals converge. So it affords itself like a really nice anatomic structure. So when we numb that nerve, what happens is you power down the whole network. So instead of just like, a little piece of your jaw being numb from the tooth, or if somebody were to numb a nerve to do stitches on your arm or something like that, what we're doing essentially is turning off or powering down the entire network, because those signals connect between two networks, one in the brain, one in the body. So when you do that, within just a few minutes, what most people feel are a few things: You may feel something in your mind, such as a quieting or a calming sensation. You may feel in your body some things like your muscles relax. It might be your jaw muscles or your neck muscles or your back, or some people feel their chest muscles loosen because they say, oh, I feel like I can take a deep breath now. Many people get emotional. Many people cry. And sometimes people cry and they don't even know why. They're just laying there and some tears come and they may feel an emotional release. But these things can happen within the matter of just a few minutes. And what I typically do is after the procedure's done, I just sit in the room with people. It's a nice, quiet little clinic room. And it's nothing fancy with a bunch of scary lights or nothing. So we just sit there and quietly, I wait for the nerve to go to sleep. And what people report to me is, I feel a little calm, and then they'll feel some sensations on the right side of their face, which are the physical confirmations that I did the procedure properly. So if you've ever seen a picture of somebody that's had an SGB, they have a droopy eye on the side of the block, which is temporary. It lasts for about 8 hours, and it's called Horner syndrome, and that's the result that the nerve has gone to sleep. So it's kind of cool in a way. You have like a physical confirmation that the doctor has done the procedure properly on you. So when you walk out the door, you look in the mirror, you got a droopy bloodshot eye, a stuffy nose, and stuffy sinuses. And these are the normal responses of the procedure taking place. So you can know it was done properly. So people feel all those things within just a few minutes, and the numbing medicine wears off in 8 hours, and people's eyes go back to normal. Their sinuses clear back up again after about 8 hours, and they're back to what they felt like and looked like before there.
Is that the length of time that SGB relieves some of the PTSD symptoms, 8 hours, or does
no.
that component...
That's worth clarifying, so thank you. Yeah. No, the medicine itself wears 8 hours. Wears off in 8 hours. And all that does is signify that the nerve is turned back on again. So specifically here, you asked the question, is this like a steroid shot for your back or something? They're actually very different. Because if you inject a medicine like a steroid, there's essentially a shelf life to that thing. And it may provide benefit for a few weeks or a few months for some pain reasons. But then the steroid is kind of used up and it doesn't do its job anymore. What we're doing with the SGB is in the best way to describe it really is like a reset, because the medicine itself turns the nerve off. The nerve goes to sleep for 8 hours, but then it wakes right back up again. If that's how long the benefit lasted, it'd be a horrible idea, right? So that would make sense. But what happens is by resetting the system or rebooting the network, what you end up with is, prior to the SGB, you have a network that's spinning or humming along at a level that's too fast, almost like your engine is stuck at a high state where like somebody's mashing down on your gas pedal and your RPMs are revving up higher than they should be. And they're just sitting there like that all the time. What the SGB does essentially is like take the foot off the gas pedal, allow your gas pedal to go back to normal, allow your engine to go back to idle. Then it's sitting where it's supposed to be. The next logical question people ask is, well, hang on a second. Is my fight or flight system going to work? Like, I need that thing. It protects me, it protects my family. Absolutely. Just like your accelerator in your car works. If you let the engine go back down to idle, if you need it to go, you hit the gas pedal and it goes. So this is not putting a governor on your engine. It doesn't do anything to numb your senses or slow your reaction times or anything like that. That would be a horrible idea.
And that's a lot of guys' concern about drugs, right? Sure. I just feel numb all the time. I've got no reaction to anything.
Yeah.
This doesn't do that, is what you're saying.
No, not at all. It's I think the big reason there's an appeal for it. But I think most people intuitively who are accustomed to being on guard or on edge, whether they want to or not, they become accustomed to scanning, protecting, making sure that things are safe around them. The idea that I would lose that is scary to a lot of people, particularly people who are veterans that then work in law enforcement or firefighters or stuff. But regardless, that does not happen. In fact, it's almost the other way around. There's a little bit more of an improvement in things like concentration, reaction times, which we've studied, which surprises people. And part of that is we're kind of unburdening the fight or flight system with all this trash and all this clutter that's been bogging down the system for so long, that if you reset the system and remove that stuff, people sometimes are shocked at how their concentration improves, how they're able to think a little more clearly as a result.
You mentioned the research in that answer, and I guess that's what I'd like to go to next. Is there, because this is what medicine's all about, right? Is there clinical, research and clinical trials and sort of the stuff other physicians would look at, other folks would say, yep, this is well researched, there's been clinical trials, it has a positive outcome for people?
Yes, absolutely, emphatically, that it does, and that I think that's important to me. So I'm a clinician, meaning I see patients all day, every day, but I've been a researcher for years, and much of the research on SGB was begun in the special operations community in a few units in the military. And it was done by myself and some colleagues. So I feel very strongly that if you're going to do a procedure, something like this, that's a little cutting edge or a little forward thinking, it can't just be a bunch of stories from people who say, "Oh, I felt great." Like that's fine, but the anecdotes don't mean anything. So what we have done is focused a lot of effort in terms of conducting studies, publishing them in peer-reviewed literature, which is kind of a chore. You have to really withstand the scrutiny of the medical community. But once you've done that and you have studies that are published in the peer-reviewed literature, it rises to a different level. This is now not just a bunch of anecdotes or somebody's good story. It actually is proven. So there are several randomized controlled trials, which are kind of the highest level of evidence. One I was involved with when I was still on active duty, that was a multi-center trial that was done between the hospital in Hawaii, Tripler, the one in Germany, Landstuhl, and Womack Army Medical Center at Fort Bragg. And it showed then that the results from the stellate ganglion block on PTSD symptoms were twice as effective as a sham injection. And we literally did a fake SGB injection in a muscle in the neck, right? So this is about as good a science study as you can do. And it was a overwhelming success. It was published in JAMA Psychiatry back in 2020.
So I think that's important for folks to know, that it's well studied. This isn't anecdotal information. A couple of questions I want to get to before we run out of time.
Yeah,
and that is this treatment something that the private sector insurance industry pays for?
No insurance will cover it, including TRICARE. Okay. Now, it is conducted in a few military hospitals still. So if you're on active duty and you happen to be lucky enough to be in that area, you can get treated at hospitals. Same with the VA, right? So that's the next obvious question would be, right. What about the VA, right?
That's where we're going.
I'm sorry, but just to put them together, this stellate ganglion block has been looked at by the VA for years. I've been involved in many discussions with the VA to bring this to a more widespread use, and it is in the clinical practice guideline, but has not been widely adopted by the VA.
And that gets you to an advocacy effort that's ongoing that we want to bring to veteran radio listeners. And we're talking to Colonel Jim Lynch, MD, retired 31 years in Army medicine, who's a leading expert in this stellate ganglion block SGB treatment for PTSD. The advocacy effort, talk about that now, because I think that's where the regular veteran who says, "Man, we ought to have access to this. How do we help get access to this?"
Yeah, so thank you for that. Probably most important question. So currently, there are some VA hospitals who offer stellate ganglion block. And right now, it's left up to the discretion of the individual hospitals and their psychiatry departments to recommend it and to have somebody a patient ask that they want it. That is nowhere near where it could be or should be, in my opinion. The VA looks at adding new treatments to their armor. The VA looks at adding new treatments about every 5 years to their clinical practice guideline, and they have a very strict guidelines of what they will consider acceptable risk and acceptable standards for the VA. I'll just say that there seems to be adequate evidence to show that stellate ganglion block could be helpful in the VA. Not only helpful, but very, very helpful. And if you look at the other treatments that are recommended for PTSD in the VA, for instance, if you just look at the top 3 medications that are recommended, each of them hold black box warnings for suicide. And there's this whole calculus that should be going on that weighs risks and benefits and cost and time of treatment and all these things. So this is not a unilateral or a single focus, like we're going to figure out how good SGB works, and if it's good enough, it'll work. There should be, more variables looking at it. To give you an idea, stellate ganglion block takes about, I already got done telling you, it takes about 10 minutes, 15 minutes. I take an hour with people because I like to explain things and not rush people. So a visit can take 30 minutes. It can do a procedure that reduces PTSD symptoms by 50%. We've studied the duration of symptoms, and for our most recent randomized controlled trial that we conducted with Ohio State, we tracked results out for a year, and the symptom scores drop 50% and stay down for a year. So think about that. A single procedure takes about a half an hour, costs minimal. It's not a bunch of fancy equipment. It's a simple anesthetic, and it can reduce your PTSD symptoms by 50% for a year. Or you could use all the other things that the VA recommends, like medications. Some of them are very helpful. Many of them have very bad side effects. A lot of them people come off of because the side effects are not tolerable, and other things. There are other therapies that could be used that take a long time and have their own issues. I always recommend that SGB should be used as an adjunct to talk therapy. So not as a standalone thing at all. I actually think it works great when paired up with therapy. So what I think the VA should be doing, and why I think we need advocacy to get their attention on this, is because this procedure, SGB, has been studied to make the other talk therapies way more helpful. Work faster, work better, work longer. It's in the published literature. So unfortunately, we need something to push on the system.
And that's the call to action to our veteran radio listeners and the advocacy. I think Dr. Lynch, being a medicine man, is maybe not pushing as hard as he could, because we have an administration that has recently advanced looking at psychedelic treatments for veterans with PTSD. Now's the time for this administration to say, hey, let's get SGB into the VA and into the process in a more robust way. You can go to TrumpSGBAct.org, a website that is set up to help you tell veterans and their advocates, hey, how do you take action on this? How do you try to build the momentum for change? And that's a little bit of what's going on at the moment, is trying to build that momentum for change, isn't it, Doctor?
Yeah, I'd say that the thing is, I was struck with the same enthusiasm as other veterans who you've been watching your friends and buddies take their lives by suicide by the 20s daily for years. So it's personal. This is not some, I'm not some doctor in an ivory tower somewhere talking about this. I get it. So the frustration for me is this. I see all the excitement over the presidential executive order of Ibogaine, and I think, great, good. We got people that are opening up their minds to doing things, but that's going to require a lot of studying and time and things. We have SGB now, Stellate Ganglion Block now, if somebody flipped a switch, they could make it happen. The level 1 published evidence is done. It has a fantastic track record. It's been around 100 years, so we know all the safety data on it for 100 years. It takes 30 minutes and has a tremendous effect. So for me, I love the enthusiasm behind new things, and people always get excited when there's something new coming over the horizon. But this thing's sitting in our backyard, and it just needs a nudge, like a lot of nudges. And I hope that the listeners out there will listen to it and just say, geez, this is, to me, it's common sense. I mean, this is like my mom understands this. I don't understand why politicians, I don't understand why policymakers at the VA level wouldn't look at something so obvious and just slap the table and say, make it happen.
So
I
I
don't
want
get
to
it.
give listeners two websites. Grab your pens if you want to know more about Dr. Lynch and his practice and whether or not maybe he can help you with something. Go to drjameslynch.com. He's in Maryland. But you can also, as I mentioned, go to SGBAct.org to get involved in the advocacy piece of this, understand more about the treatment process, but really help make changes for people, get those policy decision makers to move the needle a little bit. Dr. Lynch, we certainly appreciate the time you've given to Veterans Radio today to educate us on SGB, and hopefully our listeners can help educate some policymakers on it as well.
Yeah, I thank you for having me on. I think the word has to get out. In the meantime, I'm sure there's listeners that thought, geez, I never heard of this thing before. I hope you go on the website, look through that stuff. There's a bunch of videos that I put on there to help explain things. And if anybody out there needs help now, wants help now, call us. We're a small mom and pop veteran owned business in Maryland, not far from BWI Airport. And all we do is help people every day and love it. So reach out if there's anything I can do to help anyone, anytime, anywhere. Sincerely.
Colonel, we really appreciate your time today. Thank you.
All right. Thank you, sir.
And I want to thank everybody for listening to Veterans Radio today. I am Jim Fausone. It's been a pleasure to be your host. I'm a veterans disability lawyer at Legal Help for Veterans, and you can reach us at 800-693-4800 or legalhelpforveterans.com on the web. You can follow Veterans Radio on Facebook and listen to its podcasts and internet radio shows by visiting us at veteransradio.org. That's veteransradio.org. We again want to thank our national sponsors, the National Veterans Business Development Council, nvbdc.org, Legal Help for Veterans, a veterans disability law firm with a national practice before the VA, can help you on your claims and your appeals. It can be reached at legalhelpforveterans.com or 1-800-693-4800. We also want to thank our local sponsors. This would include the Charles S. Kettles chapter of the Vietnam Veterans of America, that's chapter 310, VFW Graf O'Hara Post 423, the American Legion Irwin Preskin Post 46 in Ann Arbor as well, the VA Ann Arbor Healthcare System, and certainly the National Vietnam Veterans of America Association. You can be a sponsor by going to veteransradio.org, clicking on the About Us and our sponsors, and help us out. Keep this program alive for the 21 and 22 years. Keep us going for another 20. Thank you.